expert warns dehydration during hot weather may lead to blood clots. I remember the last time I went for a checkup, they had to take some blood samples from me, and the blood wouldn't come out. And and the nurse was trying to jab me more and more time. I said, forget it. So another nurse came and says, give her a glass of water. And they came back 5 minutes later, and my blood was running very nicely. And I was shocked. I was saying to myself, 1 cup of water made my blood run through my veins. I mean, what was happening to me when I didn't have that much water? I mean, I was shocked. So that's why I'm telling everybody now, especially in the hot water, the hot weather, drink a lot of water. So dehydration during hot weather, of course, may lead to blood clots, the experts say. Not drinking enough liquids or even having enough fruits and vegetables. A nice salad is nice in the summer. So not drinking enough liquids during the hot weather can have far more serious consequences than health problems like heat stroke, according to a consultant venous surgeon, Professor Mark Whitley. Dr. Whitley said dehydration means your body loses more water than you're taking in, and he warned that this can actually result in deep vein thrombosis due to clotting in the blood. Express reports found that the founder of the Whiteley Clinic, which specializes in veins, explains dehydration affects the constituents of the blood, making blood thicker and more sticky. Blood flows at a slower rate in veins than in arteries. Therefore, being dehydrated can therefore increase the chance of developing a blood clot in the veins. A blood clot in the veins is called a thrombosis. The most well-known of these is deep vein thrombosis, DVT. If untreated, DVT can be dangerous. The NHS says blood clots in your veins can break loose, travel through your bloodstream, and get it stuck in your lungs. This is called pulmonary embolism. A pulmonary embolism can be life-threatening and needs treatment straight away. Professor Whitley advised, in order to avoid becoming dehydrated, it's impossible to drink plenty of fluids, including water, diluted squash, herbal teas, and fruit juice each day, especially if you have other risk factors in blood clots. Tea and coffee have caffeine, which actually cause you to lose water. Well, I'm a coffee freak. I'm not going to stop my coffee. I'll just drink a lot more water. Anyway, hence these and alcohol can make dehydration worse. In warmer weather, it's important to up your water intake to account for the fluids lost when you sweat more. It's also recommended to avoid drinking too much caffeine or alcohol and stay in the shade as much as possible and avoid direct heat, especially during the hottest part of the day. This is according to Neil Harris on News Punch. Now, what about the dehydration symptoms? How to avoid dehydration throughout your everyday life. And I'll read a post by Doug Rich, a doctor. He says dehydration, commonly defined as harmful, reducing the amount of water in the body. It does not just affect you when you are outside sweating or when hiking through the hot desert. Dehydration can affect you just as easily when going through your normal daily activities. And he says, what are the symptoms of being dehydrated? 1, dry mouth. 2, headaches. 3, increased thirst. 4, a low volume of urine and a darker yellow color of urine than normal. 5, tired or sleepy. 6, dry skin. 7, dizziness. 8, muscle cramping. And he says, how much water should you drink every day to stay hydrated? To keep your body hydrated, how much water should you drink each day? It's a question we're asked on a weekly basis. He says the answer to this question will vary with almost every individual. Activity, size, environment, age, medications, and type of fluids can all affect the answer how much fluid you need to take in a day. Most physicians, when pursued, say you need 8 to 10 glasses of water a day. Of course, that leads to the next question, how big of a glass? Well, most juice glasses are about 8 ounces, so 8-ounce glasses of water, 8-ounce glasses of water equates to 64 ounces a day. That's about 2 big gulps of water from your local convenience store. Other common questions include, how does my shape and size affect what I need? What if I sweat a lot? What if I take diuretics? What if I work out a lot? The rule of thumb is you can use this. Drink half your weight in ounces of water a day. If you weigh 100 pounds, then most likely 50 ounces a day is enough. If you weigh 160 pounds, then 80 ounces is probably enough. Even then, no answer will be perfect for everyone. It's just like large dogs need more water than small dogs. Now, the hypothalamus function and location. What part of the brain controls thirst? He says, well, our body has a built-in thirst regulator called the hypothalamus that kicks in when it feels the body water levels are becoming too low. It'll tell us when we're thirsty and need to drink something. You might get, great, I will simply drink when I'm thirsty and I'll be okay. But that isn't exactly the case. If you're taking in around 60 ounces of water and you're not very active, you're probably okay. However, if you're drinking caffeinated beverages, that's me, you will not be getting the hydration necessary to function. Caffeine is a diuretic, which means you'll basically counteract whatever hydrating fluids you drink. And even then, it is not that simple. Oh, I know what else I like. Oh, I like to squeeze some fresh lemon in my water, and it's almost like a beautiful lemonade. I love that. Maybe I should turn to that. Now, the hypothalamus tends to quit working in our later years. As our hypothalamus becomes less responsive, you'll begin to not feel thirsty as often. And in these cases, people tend to hydrate when they feel dry mouth, also known as cotton mouth. Unfortunately, a small sip of water can rid this symptom while not being enough to replace what your body is actively losing. Effects of dehydration on the body. A cardiologist friend of mine calls dehydration the 80-year-old dropout. Patients are admitted to his ER complaining of dizziness, slurred speech, rapid heart rate, elevated blood pressure, and sometimes have passed out. The patient would immediately have been put on saline drip after being transported to the hospital, and in about 3 hours later would be ready to go home feeling normal and healthy. Due to the commonality of the event, the doctors began looking at echocardiograms he ran on many of the patients when they were first admitted, and the results, the heart and major arteries had shrunk down. However, echocardiograms ran a day later after the patient received the IV saline solution showed normal heart and artery size. So even your arteries can shrink. Can you imagine? That's not good. This is ridiculous. So let's all hydrate ourselves, dear viewers. Keep hydrating. Now, his explanation was that the shrinking of the heart and arteries, as well as the thickening of the blood, were all due to lack of water, which in response, the arteries would then squeeze down as the heart begins to pump faster, attempting to increase the pressure in order to move the thicker blood. I mean, that's, okay, you can understand how the poor heart is going to, let out. Now, this can become so severe that a person could not get enough blood in their head, leading them to pass out. So to avoid this and the IV of saline solution, stay hydrated as best you can, the doctor says. How to tell if you're dehydrated? And he says this is a nice test. It's the skin test. By pinching the skin on the top or backside of your hand, you can easily check whether you should be drinking more water. If your skin bounces back to a quick, smooth position, then you are less likely dehydrated. Let me do that now. It doesn't, well, how fast should it bounce back? He doesn't tell us. But it bounces back. It's okay. If your skin slowly goes back flat to your hand and leaves a crease for a few seconds, then it's probably time to find some water. Okay, I expect you all now to do your skin test on the back of your hand. Not on the palm, but on the top of your hand. Okay. It takes my skin about 1 second to go back. Now, we hope this information on dehydration, he says, and the accompanying hydration tips help you stay active and healthy this summer. This is by Dr. Doug Rich on Footsill Rehab, and I'll leave links below for you for this. So all of you, okay, let's cut down our coffee to 1 cup a day, or maybe 2. Drink a lot of beautiful water with a beautiful lemon squeezed in it. It tastes like lemonade. So, okay, more power to you. Please leave your comments. Thank you for your support. Kindly support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.